So anti-VEGF injections have really revolutionized our management of neovascular AMD, diabetic macular edema, and central retinal vein occlusion with macular edema. But people are very averse to getting injections in the eye. And I find that the ability of MicroPulse laser to be offered to patients that can allow them to essentially get treatment that is non-damaging, that is potentially repeatable without pain and discomfort, really offers a second option for patients who potentially can benefit from treat as an adjunct therapy for treatment. I think MicroPulse has affected my use of anti-VEGF or pharmacotherapy in two ways. First are patients who've been getting many repeated injections, who are tired of coming every month. They often want to know about other options. And while I don't think it's easy to get them off of those anti-VEGF injections, I often try to offer something that could potentially reduce the burden of anti-VEGF therapy. The second patient population I find that's useful are those who are just at the cusp, at the borderline of needing to initiate anti-VEGF therapy. Those patients often are asymptomatic, they have very mild disease, they're very resistant to the need for getting a needle in the eye. And so for those patients, I often will offer this as an option to potentially reduce their chance of needing anti-VEGF injections in the future. So MicroPulse laser, I've explained to them, is a very mild, safe treatment that kind of alters the pathophysiology of the disease without actually causing permanent damage to any part of the retina. And that usually patients are very open to. Patients love the idea of a laser treatment versus a needle, which sounds very brutal. Oftentimes there's a upregulation of what we call heat shock proteins. These are proteins that are upregulated during a stress response. It has been shown scientifically that cells that have upregulation of heat shock proteins essentially improve their ability to stay healthy. And so in that sense, MicroPulse laser has the ability to improve vision even independent of the classic anti-VEGF therapy. So the way I've been incorporating MicroPulse into my practice is from two groups of people. The first is actually people who've been getting a lot of anti-VEGF injections and are unable to get off of them. The second group of people that I find that's useful are those who have very early disease, who might not necessarily need anti-VEGF injections yet and who are resistant to getting injections in the eye. And I find that for those people, MicroPulse laser offers a second option of potentially using a non-damaging, safe energy delivery system that can allow them to change the pathophysiology of the disease so that they don't need to get to the point where they need anti-VEGF injections. It is true that currently there's a dearth of evidence of randomized controlled trial demonstrating a clear benefit to MicroPulse laser. However, I do find that for patients, MicroPulse laser is something that we can treat through the entire macula, even through the fovea, without any evidence of damage. And I think that that potential is very exciting for patients. And I think it's a great option to offer as first-line therapy to try out with patients. The way I teach residents and fellows about MicroPulse laser is that the goal is to actually cover the entire area of the edema to change the pathophysiology of the retinal cells in that area. So I often will explain that you need to put confluent spots. They have to be right adjacent to each other, not leaving any gaps, and that it's safe to treat through the fovea. It's a very different method and technique for applying MicroPulse laser versus continuous wave laser. I think the use of laser in ophthalmology is here to stay. Laser has always had a role in ophthalmology as early as the use of pan-retinal photocoagulation during the diabetic retinopathy study to the use of focal or grid laser in the ETDRS study. And I think the role continues to change as time changes. And what we're finding is that there are new applications, particularly with the advent of MicroPulse laser. Having that second arm or second option, I think, continues to be important in ophthalmology today.